Zone Ads, World of Local Business Info.
Neurogenic voice disorders, we see this vocal cord paralysis in general is a neurological voice disorder where there are many types, subtypes in that, but when you see that the other vocal folds, maybe one or two, may not function, approximate properly and may not retract properly. So this flexibility will miss because of many other reasons. So it may be psychological reason also may impact this, and also neurological reason or any other neurological damage may also lead to this vocal cord paralysis. And nowadays we are seeing the neurological, this vocal cord paralysis even seen in very normal people, those who don't have any cause, those who don't have any significant history. So this is there. So one has to be careful, and there I feel our role, SLP and voice therapist role, is very essential, and we have to be careful. People are saying maybe due to corona, COVID, vaccines and any other pollution, so many issues may lead to this. Suddenly when you wake up in the morning, the voice is lost. And when you go through the imagery, this one, they find that there is a vocal cord paralysis. So it may be unilateral, majorly unilateral. Then comes to the psychogenic voice disorders, such as dysphonia with many other, it may be like shocking events, any other event may also lead to dysphonia. Even now if somebody threatens us or some secret has to be told by us, then definitely our voice becomes dysphonic. If you notice, means it becomes aphonic and like very soft voice and other. So this is a psychogenic one. Okay. Then comes to the puberphonia. We know that puberphonia is a also known as mutational falsetto or juvenile voice disorder, which starts in teenage and where it has to happen normal. That normalcy is not obtained, and they get this puberphonia condition with high pitch voice, and this may be even present in the woman. So that is very high pitch voice. So don't say that puberphonia is not only for the males. Puberphonia is also, but it is not common comparing to male. It is also there with the females. Then coming to the androphonia disorder, you know that the cause is not known here in general, and maybe the harmonic imbalance, maybe the hormonal growth is not proper. Then we find androphonia condition. And when you see the puberphonia prevalence, it is 1 among 9 lakh people or 90,000 people, it is said in the literature. But when it comes to the androphonia, there is no certain prevalence studies have done. Now coming to the evaluation of voice, where it is very important. We know, please cooperate here. Please cooperate. I'm hearing voice. So coming to the voice evaluation, when we see the voice evaluation, a detailed case history is very important, and how it is important that we are going to speak, know it. And perceptual assessment, including scales and questionnaire evaluation, and objective analysis are important. And coming to the laryngoscopy and video fluoroscopy and video laryngoscopy. These are scopic examination, however, done by the ENTs here, and fortunately in future we may also do like other Western countries see. Then coming to the case history, after the demographic data, the complaint onset, possible etiology is very much important to correlate the condition. So okay, and medical history, where they have undergone, and you know why we have to take medical history, because certain medications and even the surgeries may lead to voice disorder. Even the correction of somewhere here, down or other side, we may see there is a voice change. So there is a body is it has a comprehensive mechanism where it reflex is when the stimulus is given, when the knife is touched to the body, it behaves differently. Like heart attack is also very common when you go with surgery. That's why they take consent. Even for the leg surgery also, they take consent. So that is important. So medical history, we have to go through that. What is the condition before, and how the development is. We see number of, if you go with the nodules and polyps and all, when you do surgery also, they reoccur again. Certain conditions are there, and few conditions like mild category of nodules or cysts, where with the voice therapy only we can eradicate or we can cure it. Okay, certain things are there in the voice therapy. Beauty of voice therapy is that it is not only with the surgery, it is not only post surgery, even the certain complications we may get down. And coming to that, developmental history is important. As we know, secondary behavior, this secondary issues are very important. They gives us the clues about the voice changes, and whether it is optimum or not. You know that high pitch is with female and very high pitch is with children, and when it comes to the male, it is a low pitch around 120 hertz. So vocal behavior, frequency of good and odd and abusive behavior is very much important. What is the frequency of his teaching, how much longer time he is teaching, singing, yelling. We have here one of our friend also, who is a singer. He has done extreme singing and he lost his good voice. So certain things are there. So where just before sir has said, there is anyone can sing and one can sing beautifully, but he has to consider, take care of certain vocal hygiene behavior. Vocal hygiene is very much important. Be hydrated, be positive, and do vocal warm-ups. Vocal warm-ups I have demonstrated in previous my lectures, where the vocal warm-up is very much important, like your body warm-up when you do in the morning. Certainly, vocal warm-up is important, and you know that in classical singers they do with Shruti. They start with Shruti because that is known as vocal warm-up for them, and it is very much important. And you know that the certain behaviors such as chewing palm, gutka, smoking, and occupational hazards where they are exposed to chemical fuel, means audio, and other things are also we have to take care. Even the loud noise will affect voice. You know that loud noise, how it is going to affect voice? Lumbar. We can say that lumbar. Then when it comes to the perceptual evaluation, Grabas, this scale gives, this is a 4-point rating scale. It gives the severity of this. It is a simple method where we can go with the severity of the problem. The grading, roughness, breathiness, asthenia, that is weakness heard in the voice, how is the voice when it comes to the loudness, and the strain and instability. So this is what commonly used, but in our practice I found this is a beautiful perceptual evaluation which we do in NIHH from long back, from decades, where you see the severity rating. It's a clear, crystal clear. How is the pre and how is the post? When you go back to this, where you cannot see, you will see only grading G1, R2, something like that. But here you can see graphically also. So directly you can see habitual pitch, how it is, pitch range, how it is. The beauty of this is pitch range is also covered here. Pitch range is very much important because we are only worried about the voice. It should not be monotonous. It should be flexible, right? That is important. So pitch range gives us low pitch. Every voice has a note, octaves. That has to be taken care. It is not always just a voice always speaking at 120 or 150 or 220. No. So that gives that, and quality, resonance, diplophonia, that is two pitch at a time, and pitch breaks where the pitch is broke, and inflection, that is inflection. Just I was telling you, it should be intonation should be carried, melodious. Then when we see that theoretically these are the two scales which are used for voice evaluation and the bothersome which they are undergoing, that is voice handicap index 10 and voice handicap index given by Jacobson et al. This second one is the first scale which was developed, and it has got 30 what we call questions, which comprises of physical, functional and emotional aspects, and where we categorize based on the score, that is 5-point rating score, 0, 1, 2, 3, 4. we calculate it, add it, and we sum it, and we will come to the severity like 0 to 30 is mild, 31 to 60 is moderate, and 60 to 120 is severe category. And when you see the mild one, generally it is less handicap, whereas moderate will you can see with the nodules, polyps, and cysts. Severity in general. This is not perfect, not only for them, but it is in general. When it comes to the severe, vocal cord paralysis and aphonics, we see it as a severe because it will affect more. When this is a VHI 10, voice handicap index 10, it is brought from this bigger one. They have concised into this smaller one only, where we can do almost in 2 to 3 minutes we can complete this question. Maximum 5 minutes. 5 minutes, in 5 minutes you will know the severity estimation. It is very easy. One can follow this. VHI 10. So again here we have 5-point rating scale, that is 0, 1, 2, 3, 4, where the scoring is given, and we will estimate the pre and post after before therapy and after therapy. When we come to the objective analysis is instrumental usage. When we use instrument and we measure and we obtain the results. So this we get. So the stimulus, which it can be like phonation, and the maximum phonation duration, you know that 25 to 25 is for males and 15 to 20 is for females and 10 is for children, and this should be maintained. And SASA ratio, you know that equally it should be equal. If it is not equal, then there is a problem. We can find there is a problem in the continuous striking of the two vocal folds. And coming to the fundamental frequency, fundamental range, jitter and shimmer. Jitter and shimmer these are known as perturbation, changes in the cycle and changes in the amplitude is known as jitter and shimmer. And when we come to these all, tremor and other things, when we come to these all are instrumental based. But at the end and first, this is what is the beauty, because instrumentation is not available with everyone, and the cost of instrumentation is more, and you should have minimum prac to do few analysis. Nowadays you can see what we call various apps also, like voice tools and etc., where we can estimate, but it is not purest one, remember. Yeah, this is not finite. We can just estimate with that pre and post. Qualitative one, it is not a quantitative, though it appears. Then case presentation. So my case, you can see, let's see first the video, so that you can appreciate means you can evaluate directly. So she's a case.
My name is Deshika. My voice is completely male voice. Please change my voice female.
This was during therapy. Before therapy, I don't have video. So, but fortunately, I had a voice recording. After almost 1.5 months, this is a very peculiar case, because we generally see puberphonia, but we don't see androphonia. Very rare, and if we target these people, we will get many cases. Even transgender, those people, those community, we can focus and we can get that community to our, so that we will increase our caseload. So actually I have to show you the photo, then you can see even after the therapy, even the laryngeal structure which was elevated earlier, because out projecting out, after therapy it went inside. And that remark was not given by her only. All her neighbors, relatives, that her even facial appearance has been changed. So that is a beauty which I come across in my first time in my history. So that change is given. Not only voice, appearance also was changed. And how it got changed? So you can see that Pre-condition, there was low pitch voice and limited range of voice. Remember this, because otherwise it will be monotonous. If our range is not changed. And post therapy, we have obtained high pitch voice, near normal optimum voice, and good inflection. There is a change. There is a modulation is there. Intonation has changed. So this is that, and I have not mentioned that. Even the physical things, appearance has been changed. That's a goodness of this happened. And therapy wise, what did I use? Generally, everywhere, most of them, they neglect oral exercises. Oral facial exercises are very crucial, because I have sensed it, I have observed in many cases, this has an impact. Oral peripheral exercises are very important, along with breathing exercises. Breathing exercises need to be again followed with your laryngeal massage. Laryngeal massage has direct impact, because it improves the circulation of blood to the region, stimulates that region, and reorganizes that region. Then there is an impact. What therapy technique you use, whether you use digital manipulation, pushing, pulling, etc. Okay, so what I practiced, what I used, my technique is, I used Bastrika, which is there in the yoga technique, and also Sudarshana Kriya, which I learned from Art of Living. So I have implemented that during my COVID time. I have learned this, undergone this course. Then I have adapted that and saw there that there is a drastic change in many of the cases, not only one of the cases, where because the vital capacity is increased. When your vital capacity is increased, the powerhouse is there. You can use that power to many other things, like pitch variations, loudness variations, and other things. Even the Brahmari is also recommended, but I am just started it. We have to see. Then the other case, like vocal fold paralysis. So the other demonstration. This is
ATP problem. Okay, ఎప్పటినుంచి? ఓకే, దీనివల్ల ఏమేమి సమస్యలు ఉన్నాయి నీకు? ఓకే, సో ఎన్ని నెలల నుంచి ఈ ప్రాబ్లం ఉంది మేడం? ఓకే, సో ఒక్కసారి అనండి.
You can see her, how is her voice total.
మీరు ఇప్పుడు ఎవరితో వచ్చారు? ఓకే, ఎక్కడి నుంచి వచ్చారు?
Now you see post therapy. How see her pitch range, loudness, and voice totally. Her time of speech has increased, duration is increased, loudness is increased, hoarseness is gone, breathiness is gone. Then her confidence has increased, and you can see here there. How is the voice? Vocal cord paralysis. Almost 10 sessions, 1 week, 1 month it has taken, but excellent result. And she came to know that there is a voice therapy, which is separate field. She went to doctor, ENT doctor, and he has referred to me, and fortunately it has went very well. And you can see again here, her voice was hoarse, breathy, and limited range of pitch. And when you see post therapy, it is audible level with good inflection and no hoarseness, harshness, breathiness. And the techniques I used again, the similar one, inhalation phonation, laryngeal massage, oral exercises, and breathing exercises, including Bastrika and Sudarshana Kriya. So this has an impact very well. So next, any other day, we also can demonstrate, and we will do better for our own people. So coming to the summary and conclusion, voice is a dynamic phenomena and thorough evaluation is required, including case history to subjective analysis, that is using scales and handicap inventory scales, etc. And appropriate management is required. It should be there. Compulsory one should be the oral exercises. Like our counseling is important, confidence is important. Similarly, oral exercises, laryngeal massage, breathing exercises, including Bhastrika, Sudarshana Kriya, and other therapeutic techniques appropriate to the case are important. And importantly, for all the even the government and non-government practitioners, please it is important, do evidence-based practice, have a report, collect a report. If they are shying or if they have objection, do there in their own mobile, but keep that record. So tomorrow you will find out any change. If there is no change also, no harm is there, right? So some cases, very few cases, we cannot find improvement. There are 70-80% only there we can see the improvement. Certain cases either we have to refer to the team of otolaryngology ENT, or we have to accept that certain cases like bilateral vocal cord paralysis, the neurons and nerves may not respond, and there is no surgery which really gets into that because there are complications in that. Then record it and preserve it. That will save you and us. Okay, practice well. Thank you very much. Thank you very much.
Subscribe to our channel, click the bell icon and select all.